Hello everyone, I hope you're enjoying good health. In this session, we are learning about OET. When I say OET, I say everything about OET we are learning today. We are basically talking about what is OET. We'll talk about that which are the professionals who can take OET. We'll also talk about test format of OET. We will also talk about the subtests of OET, and most importantly, we will talk about the difference between IELTS and OET in the end. And most importantly, whether you should go for IELTS or you should go for OET, we will be trying to help you with that. So let's begin with it. First and foremost thing you need to know about OET is that OET stands for Occupational English Test. So that makes it profession specific. Okay, let's not compare IELTS for now. We will be talking about IELTS in the end. For now, let's talk about the OET only. So it is Occupational English Test, which has 4 subtests, and it assesses the language communication skills of healthcare professionals. It has 4 components. It has reading, writing, listening, and speaking for sure. Let's move on to the next one. OET is available for the following 12 professions or professionals. If you are a dentist, like dentistry, dietetics, medicine, nursing, occupational therapy, optometry, pharmacy, physiotherapy, podiatry, radiography, speech pathology, and veterinary science. If you are from one of these professional professions, you can go for the OET to achieve your studying abroad perhaps, or maybe getting assembled or getting set abroad. Most importantly, the test taker include 47% nurses. It's been seen that they are taking the test, and 23% with the doctors, 20% dentists, and almost 6% pharmacists are into it. The most recommended resources to use for OET are basically the official website of OET, as well as if you are here somewhere in Islamabad, Pakistan, so we can help you as well in that. We have our own resource packs, and you can come to our branch in IET Markaz, or if you are in Blue Area or Expressway, we can surely help you with that too. Moving on, everyone, even native English speakers, are advised to take assessment tests to familiarize themselves with the test format. Okay, so if you think that you are the best speaker, still you require some basic kind of formatting or basic kind of mock you have to get, and we are helping you with the mocks as well. Such assessment exams are also found on the OET official website too, so not giving the credit, but for sure that's the authentic data you can get it from, and that is from the OET official website itself. Then we'll talk about the modes of exam delivery. First of all, these are available in 3 modes. It can be on paper, it can be on computer going to the center, it can be on computer staying at home. Okay, so these are 3 different modes through which you can do that, and the test, task, format, and level of difficulty remain the same for all the OET tests. Moving on to the next one, OET exam pattern. OET comprises 4 subtests. Listening approximately gets 45 minutes, and reading 60 minutes, writing 45 minutes, and speaking gets 20 minutes. So let's go into the division of the test one by one now. In the listening, basically, as I said, it's 45 minutes. In part 1, you can have an extract, maybe a consultation extract for now, about 5 minutes each. You will listen, and then you will do the listening comprehension on that. Part B, basically, it is a short workplace extract, about 1 minute each. The different work, extracts you listen to, and then you see the questions are given to you. You listen to the audio, and then you try doing the listening comprehension. You try giving the answers. By the way, there is one good news about OET. I'll also be giving that in the end. Part C is basically presentation extract, about 5 minutes each, and then based upon that, there are 6 multiple choice questions for each extract. And requirement is to listen for two different extracts and try giving the answers on the answer sheet. You see, you'll be having a question paper, and then you will be given an answer sheet to transfer the answer onto the answer sheet on the test day for sure. So that's pretty much about listening. Moving on towards reading now, which is the second subtest. And reading is basically about, as I told you, in 60 minutes it is. And part A is a quick reading task of 15 minutes. There are almost 20 questions in that in allocated time period. And the 20 question consist of matching, sentence completion, and short answer questions. And basically it assesses the candidates are they ability to locate specific information. Skimming, scanning, reading for gist, and such kind of things can help in that specific kind of test. Moving on towards the continuity of it, part B and part C, they have it's basically careful reading, and they're given together for 45 minutes, and you read that carefully, and then for each text there is one three option multiple choice question. Like you will normally we have four options in multiple choice question, but in the OET you will be having three answers multiple choice questions, and then part C assesses candidates ability to identify detailed meaning and opinion in two texts. Okay, two different texts. There are almost 800 words each, and for each text candidate must answer 8 4 option multiple choice questions. So that's pretty much about reading one. And part C also assesses candidates' ability to identify detailed meaning and opinion into texts. And topic actually is interest to healthcare. This is the difference between IELTS and OET here. That in the IELTS you get some day-to-day regular kind of topics, but in the OET it is profession specific. And for each text, candidate must answer 8 4 option multiple choice question, as I told you already. Moving to the writing task, here it comes the real difference between IELTS and OET. Basically, task is to write a letter. Usually a referral letter if you're a nurse, a doctor, or the paramedic staff I mentioned already, the 12 categories. If you are from one of those, so for sure, you will be writing a letter basically. Case notes will be given to you. You will be reading the case notes, and then I'll be showing in the video as well that how the answer sheet look like. You'll be mentioning the answer onto the answer sheet of 180 to 200 words. It's total 45 minutes, 5 minutes to basically prepare. You will read the case notes, and then 40 minutes you have to write on the case notes. And it's mostly about the salutation, it's about the case history, it's about the present scenario of the patient, and it's about the expectation that what do you want, to whom you're referring it to. In the speaking part, it's basically 20 minutes. Okay, and then what makes it real easy for the paramedics, that it is with an interlocutor. For example, if you are a nurse, so you will become a nurse throughout. It's not that you become a caretaker, you become a patient yourself. It won't be the case. For example, if I am a nurse, so I will become a nurse, and I will be having an interlocutor who will be helping me becoming a patient. Perhaps it's a role play. There are two role plays. So we'll be preparing our task. The task will be given to both of us. A setting will be given to both of us. It can be outside OT. It can be a general ward of the patients. It can be, let's say, some cafeteria or whatsoever. But it will be a kind of regular area where you are mostly active as a nurse, as a doctor, or as a dentist, or whatsoever you are from. That is exactly for 20 minutes. They check your, for sure, the linguistic abilities in that. They check that how competent you are. They check that how fluent you are, and such kind of basic checkings are there. So basically, if you are a veterinary science doctor, so you will be the doctor yourself, and the interlocutor, the one who will be helping you to speak, will become for sure the, what do we say, owner of the animal. Okay, if he'll become a lion himself, so, or maybe a donkey himself, so consider how would he look. So he will become that, so that you could speak to him. Scoring, basically, there is some scoring from in the OET. It is from 0 to 500, and it's 10 points increment basically. For example, 350, 360, it can't be 364, 367 now. 350, 360, 370 up to 500. Normally, on the average, the good institutes demand B grade in overall. Okay. By the way, overall, I'm not saying that overall means that a cumulative grade. It means you should have B each. Because in OET, there is no accumulative grade as IELTS. For example, you got 6 in writing, 5 in listening, 6 in speaking, and 5 in reading. And overall, you got, let's say, 5.5. It's not the case in OET, and it makes it real interesting for the people, because in IELTS, if you fail in one component, for example, you did not get the required band, you cannot go for a single component again. But in OET, you can appear again in one single component. For example, if you did not go well in writing, so you can go again, book your test for the writing only, so that speaking, listening, and writing is gone already. It makes it easy for you. So as I said, there is no overall grade. Timing and results, basically, OET is available in 14 times per year. Okay, in Pakistan, basically AEO, which is conducting into Iqra University in Islamabad, and wherever you sit, you can see on their website as well. You get the result in 16 working days, and most recognizing organizations require almost B grade, as I told you about already, and the test is valid for up to 2 years. And most recognizing organizations also require that candidates achieve the necessary grades for each subtest in one sitting. It is also part of it. Well, I guess we have talked about the basics of OET. Now it comes to a comparison between OET and IELTS. Basically, when I talk about writing module, in IELTS it is for 60 minutes. In OET it is for 45 minutes. In IELTS it has two tasks. In OET it has one task. In IELTS, if you are going for general IELTS, it is a letter and an essay. In OET it is only a letter. And IELTS, if you're from academic background, so it is going to be academic IELTS in which you have to write a report, a graph, a chart, or table is shown to you. In OET, it is same the what do we call letter only. 180 to 200 words overall you're writing for the OET writing, but for IELTS 150 words for task 1, 250 words for task 2, which makes it real extended or kind of intensive. This is a difference in speaking part basically, right? You see, in IELTS it's 11 to 14 minutes, max 15 minutes, three tasks are there. But there are no role plays. They ask questions from you about you, for example. Then they give you a cue card. You speak on that for 2 minutes, and then there are some discussion-based questions. In OET, it's basically two role plays. You prepare for the role play for 3 minutes at least, and then you speak to that with an interlocutor. In the IELTS, there is no interlocutor. And then it comes to the reading part, which I would say if you're a doctor, you should go for the OET because now you know what you're getting. But in IELTS, you don't know what you're getting because it's general, it's from anywhere. About the listening, it's almost, I think the difficulty of listening is a little higher than the regular IELTS listening. IELTS listening is somehow easy. The things are same. You see, there are 42 questions in OET of listening, and there are 40 questions in IELTS. There are 42 questions in reading of OET, and there are 40 questions in reading of IELTS. But still, if you are from the medical background, overall, I would say go for the OET. That's fine. It is slightly expensive than the IELTS. IELTS costs 40,000 now in 2022, and OET costs almost 69,000 or 70,000. But still, appearing in IELTS twice and going for the OET ones, I guess it will make the difference. So yeah, that's pretty much about OET and IELTS, as well as I have talked about all about OET over here. If you do have any questions, do comment. Other than that, we can help you preparing for the OET and for the IELTS as well. We are available in Language Markets Islamabad. 873-1234 is our office number, or 0331-873-1234 is our cell phone. If you want to have WhatsApp or something available every time. God bless Pakistan. Bye bye.